And you want to bring me Juan?
Juan has been living with us since he was about 4 or 5 months old. He came to us because he'd been badly injured and was in the hospital. And he needed a lot of attention. And he had had a lot of injuries, broken ribs, fractured skull, bleeding in his brain, bleeding in his eyes, dislocated collarbone, number of other things.
Juan was severely injured when he was shaken violently by one of his biological parents at the age of 7 weeks.
We've gotten away from using the term shaken baby syndrome because it implies a mechanism that we don't know exists in all cases of abusive head trauma. So we've moved to a more broad definition called abusive head trauma that can occur from any mechanism, violent shaking, impact, a combination thereof, and any other kind of force that you can imagine on the brain of a child.
Oh, you did it.
It can happen in a matter of seconds. A child's life changed forever. In Juan's case, and many others, the most tragic part of abusive head trauma is that the person who is supposed to show the most love is often the cause of the injuries.
I usually receive a phone call from either the hospital or from a deputy who responded to the scene, and they investigated, and they believe that there was some foul play, that the injuries that the parents explained to the doctor do not match the injuries.
Detective Marquez has experience with these cases. In the interrogation room, a doll is often used to assist in a confession.
A lot of cases, they actually, when they grab the doll, which signifies as their child, they'll actually squeeze, and they show me how much they squeeze. When they squeeze the doll, it signifies that they're actually breaking bones on the child.
But by far, the worst injuries are those that occur to the head.
We want the community to know the potential lifelong damage that head trauma can cause, from blindness to mental retardation to paralysis. Some family dynamics that are common that we see in these situations are parents who have had a child abuse history themselves, parents who are young, who are experiencing financial difficulties, who may be socially isolated, who may have some domestic violence in their own relationship. These parents tend to have more difficulty in being able to perhaps soothe what they consider to be a fussy infant. And these parents, I think, are at more risk of acting out.
They didn't wake up that morning wanting to kill their children, to kill their child or even injure their child.
Dr. Christina Stanley works for the medical examiner, and in her 15 years, she has been involved in all of the roughly 20% of abusive head trauma cases that result in death.
We have had between 50 and 60 in this office in the time that I've been here. It takes a lot of force, a lot of violent force to do this. The brain is of a young child, particularly under a year, is very, very soft.
Ma. Ma, we love you.
We're thrilled that he has the quality of life that he has. I mean, we take each day as a gift of, he is well, and he does enjoy food, and he does enjoy company, and he does enjoy bath time, and but I think people need to be aware of just how fragile an infant's brain is.
Juan will likely never walk or talk, but his weekly therapies and ongoing medical care have allowed him to surpass original expectations.
What we're doing is really trying to get the word out there. Really, it's very simple. Take a break, never shake. I mean, that really has to be the mantra. I think what we want parents to know is how to remove themselves from a situation where they can feel themselves getting frustrated and anxious, whether because a baby's crying or because a baby is difficult to comfort.
Parents who are having a tough day need to admit that and say, I'm having a tough day, and walk away.
Because this little boy was born perfectly normal, and at 7 weeks, his life changed forever. And It's like somebody took his real life away from him.